Good day to you. This is Drew Dixon Vestal, and this is for the Public Health Nursing course at Colby Sawyer under the tutelage of Courtney J. Rogers, due on June 30th, 2025. Today we're going to be talking about the community health diagnosis, and recently I did a windshield survey in the little town of Canaan, New Hampshire, and this is my community health diagnosis. Uh, The town is a small one, filled with hardworking Americans and those who have worked and settled down in the town itself. We will discuss some aspects of the town primarily related to the school, the medical availability, and current risks present within the community, along with some ways to be able to assist as we move through this diagnosis. In the windshield survey themselves, the town of Canaan is it's a classic New England town of the new millennium, a town that has stood the test of time and weather. The school is quaint and structure is in need of some attention, but manageable for what it offers. The major roadway through the town is directly in the center of the hustle and bustle of the town center, and that's Route 4. Route 4 is a link between central New Hampshire to the Upper Valley, and tourists drive it as well as locals. It is a winding road with long durations between towns and plenty of distance to drive and get tired and lose focus, and not minimize yourself to the mere speed posted. There are no sidewalks or safe destinations for pedestrians, which limit child self-transportation to visit friends or activities. And you can see that in the second photo there. The three photos that we're seeing is that left one is the schoolyard. For right behind the school, there is a park, like the playing fields back there, but then just as equal is this large unkempt environment. That middle one is Route 4 from the windshield. This is what it is. You can see the activity that it presents, and also just a closer view of the town and lack of walkways further actually downtown. Come in. During an interview with a local school nurse, Karen Islander, gave an opportunity to learn the status of children in Canaan, the community's efforts towards the children, and concerns currently present. As was noted, around the school was the playground, and it had a large park area and open grass that was available for the kids to release the energy between classes. And there was also great access to a tall grass environment. And if they don't really have a structure to, or the financial support to cover that entire area, it is pretty realistic to assume that children will get into that tall grass. Even to just go catch a ball. Ball went in there, go get it. We'll go play with it. Frisbee, whatever else they're going to be playing with out there. And both brought that environment brought up the concerns for both tick-borne and mosquito vectored illnesses. The water that was there was standing water, and that was underneath that large grassy area, which probably gives reason to why they're not mowing it, because they can't access it. So we're going to be talking about that. And while the school nurse offers what she can during the day, it is at home she had her biggest concerns, and his finding was to assist where she can. She wants to be able to do what she can for the community, but the difficult lays with the seasons, and winter depression with children not able to visit their friends is an annual trend, and summertime annual trend is a high traffic periods, which limits children from easily meeting up and building relationships, where other towns that say in a city or other areas that do have the different focuses regarding their transportation and pedestrian movement Where other towns may use the local park, accessible by bike or skateboard, Canaan children are reliant on parents driving and having the activity area be accessible to meet with their friends. They just can't get there, summer or winter. And then there's mud season, and then there's the fall times. But there were nice parks around there. It was accessing it, and not only that, as rural as it is, not everybody lives downtown. So to be able to get from your rural house into a rural town, you had to go past Route 4. Most of it. There's also Route 118, which branches off, and it showed the same concerns. Um, the nurse herself had a concern, has continuous concerns for the potential for depression in our children, and biking along the roadways were a high risk. The snow further limits their meeting locations and transportation, and thus further increasing depression. Withdrawn children utilizing technology who cannot really utilize that technology because the internet itself was not as reliant. In between, Canaan is pressed in between many towns, many mountains, and when I was there, I was noticing that my internet, my Wi-Fi, my cellular accessibility was limited. So it's really going to be spotty based off of what your house can offer or afford is another one. Some of the internet was spotty and leaving winter dependency on digital connections. During the wintertime, if they can't get to a friend's house, well, a nice alternative is that you don't need to stare at a wall anymore or just, God forbid, read a book. You do have the internet that's available, but that internet connection was a big one. The houses themselves were not all downtown, and there was a wide area for residents, which means that everyone needs to make dedicated trips and cluster their care and activities. Transferring a child to the park or play area, per the nurse, did not always fit the parents' busy schedules, so the children were left independently at home with not much outward release. So you put a dog in a cage for a long period of time, the dog's going to eventually rip things up if it can't release its energy. So relatable are the children as well. What are they going to do? They're going to get in trouble at home. There's going to be more negativity at home simply because they cannot release their energy in a positive way. And then they get some increased stress from the parents and such like that, which is just compounds with increasing potential for depression. So having a positive outlet of energy is limited simply by the rural aspects and the sidewalks. So beyond all of this, if anything was to happen medically or emergently, the EMS services was the most prevalent item in the community. They have a very large facility that does both police and EMS. There's even a training area, and it's right next to their general store. It's a very busy general store, but it was on Route 118 as well, with no walkways. And so there is an obvious strength in the community. However, the nearest hospital is either 27 or 33 minutes away, according to Google Maps. But that's also from the center of the town. That's from the center of the town, not from a rural house where the EMS first still need to gather and then go to where they were called to. So having quick reaction time, having a call to arrival by EMS and arrival in EMS to hospital, that duration, that period of time is long. So access to care is not the easiest, plus being so rural as well and need to cluster everything is a real schedule balance that the parents will need to focus on for their children. There is internet available, but not here. So really, how can we How can we focus on that, just knowing that it's a problem for right now? So let's talk about the strengths. So what's the kind of town of Canaan doing well, and what are some of the needs that still need to be met? They do get together well. I am a local to this environment, and when I drive Route 4, following the speed limit, of course, and looking out for children, I see that they utilize that green quite nicely. There is a good sense of community that is here. There are three churches downtown, which there is a strength of community within the denominations themselves. The town meetings are apparently well attended. I don't know about that one, but the nurse was telling me about that. And when change is offered at the meetings, however, availability to accommodate those changes are not always available, mostly financial or practicality of it all. But the town does do its best. However, the Route 4 is a major route into central New Hampshire again, and other popular local areas, including just around it, is going to be a big mountain for hiking, Cardigan Mountain. There's an all boys school that's up there, and there's a local motor club with racetrack that is right next to, just directly around the town itself. So some of the needs that we need to be focusing on: improved access to medical care, uh, both mental and physical, especially if there is a sense of depression potential that comes in here. Children will just have that large risk for isolation depression. And environmental hazards include are the lack of sidewalks and increased risk for insect-borne illnesses. In To increase the importance of education with the parents is something that we all need to be focusing on. We'll need to talk to the parents predominantly, as this is dedicated to their children, about pest control and also 12-hour skin check. In our area, it's some areas can get away with 24-hour skin checks, but we actually will encourage Q12 every 12 hours. What does that mean? Do it in the morning and do it at night. They might be in your bed. They might wake up with you. So uh, when you go to bed is a really good time. Say when you're out of the shower, get a family member that you trust and have a nice skin check. When you wake up in the morning is another good time. So there's an 8-hour duration. It's an option. Most times people won't really look in the middle of the day. It's like, oh, it's lunchtime. Let me get naked and do a tick check. So finding out in the morning time and in the evening before you get dressed and after you get undressed, or think about it, definitely every time you get in the shower, you want to be able to have that skin check for ticks particularly. So in order to align with the healthy people of 2030, we will want to improve a dedicated initiative for pest control of the different vectors, but predominantly being mosquito and tick-borne. And we want to make sure that it's greater than 86% is really our target of some of the households that utilize some form of pest control. And pest control could be just checks. Um, Mosquitoes are going to be that standing water. That's going to be a lot of it around the house. But the ticks themselves, just cut your grass and do the skin checks are going to be a big one. You can use a couple of different chemicals that are here and there on your property. You can have holistic versions, like have chickens, or guinea hens are going to be some options. Guinea hens are really loud. So you can utilize the chickens is a way to be able to help in your immediate area for some of the ticks. But at school, that's where we need to focus on. That's when there's going to be a sense of vulnerability. So as it stands, Canaan, the county of Grafton as a whole, is not high in the rankings for healthcare access. The location plays a significant role in these rankings, but we're not really able to change that. So if the community cannot go to the healthcare easily, then the healthcare needs to come to the community. And we will need to discuss methods um, on how to accomplish this goal with the town leaders. So let's put that on the to-do list. Some of the supported action items to focus on immediately um, will be the insect-borne illnesses, to verify the vectors that we already have, but to help mitigate and educate the population. We need to discover mobile health units in our area and options that they serve or offer, and even consider online access, though the internet is not always reliable. But for the ones that we can, what are some online options? And walkways for pedestrians. This will be the biggest ask of the town leaders, so we will need to utilize the data from reputable sources, including the CDC, and ways to procure funding for the initiative. For that, we should look at the state and provide, and private investors might be the biggest option. The state will be difficult, but those private investors, and it might even be an alternative town that's willing to support this one. We will need to review the locations of interest and devise a path option for school and social and micro locations around, such as the nearby racetrack. How can we get from the center of town to the racetrack without having to actually walk on Route 118 or bike there? Or even, which was really quite a surprising find, was their general store. As active as it was, it also didn't have a walkway. So children who might say, hey, meet me at, like, they can use their phone online, however the means are, they can send a pigeon, but they can communicate saying, meet me at the general store in 15 minutes or at 2 o'clock. They were not able to even walk to that safely. So we will, that was just a surprising find. Yeah. So the overall diagnosis and are available, but the quickest and easiest health diagnosis to immediately act upon includes the vector-borne illnesses, concerns, and ways to mitigate the potential of attracting them, contracting them. We can attract them, we're human, they're bugs. But to contract it and to mitigate it is going to be the big one. If we were able to make an initiative, focus on the school area and consider tick and mosquitoes, we may get a greater initial buy-in by the community. To focus on standing water covered by the tall plants, plant life will take care of a major percentage concern for the mosquito population, and then allow for the grass to perhaps be dry enough to be cut regularly, which will take care of the tick. So focusing on that water and drainage system in that particular area right next to the school might be the best cost-effective, bang for the buck child protection against the different vector-borne illnesses that we are concerned of. It's nice to know that there are several programs currently available within New Hampshire alone that the town can tap into and gain support from. The Safe Routes Initiative actually that was a good find. Will give great weight when it comes to governing bodies, as they will already have dealing with the other from they've already dealt with the government, and they have practice at it from other locations. So we'll just need to ask them to dedicate their efforts to Canaan, and we'll initiate the contact with them on that one. So once again, our next steps as it stands. A lot has been done so far, but it was only to turn over the rock. Now that we can see what's under it, we need to engage with the leaders of the community and acquire the funding. And partner with current available programs. So there is the list of them. We know the difficulties that acquiring the funding will be, so we'll have to get clever on that one. But to initially develop the relationship with the community leaders will be some of the first steps. Some of the references pulled from today, but again, thank you for your time. If there are any questions or other considerations, please don't hesitate to reach out to me. And thank you for your time and consideration.